I'll have to pause. Okay. How's everybody today? My name is David Hanley. I'm the dentist here at Complete Health Dentistry of the Emerald Coast. And today I want to talk to you a little bit of something different. It's heart disease and cardiovascular disease. And why would that be important to you? Every year, 800,000 Americans will have their first heart attack. Um, and in that group, half of them will have never had a symptom. Um, the standard physical doesn't test for the 33 factors, the known causes, and drivers of heart disease and cardiovascular disease. The basic tests that they run will include cholesterol. Basically, once they figure that out, they just kind of leave it as that. Tell you you're great if your heart cholesterol numbers are good. The truth of that is 50% of the heart attacks are caused with people with normal cholesterol, or happen, I should say, in people with normal cholesterol. So the numbers don't actually always kind of line up with what the standard testing is. Um, Again, and if you knew that, most cardiovascular disease, or 80 to 100% of it, honestly, is preventable, and what could we do, to help that out? So on top of that, and why I'm talking about things today is that, if you knew there was a really cheap, inexpensive, non-invasive test, took just a little bit of time, was very simple to do, it would easily kind of give you your cardiovascular risk, tell you, are you at risk for a heart attack or stroke? Is that something you'd be interested in? For me, I believe everybody should do something like this. It's good to know, like I said, especially when it's such a simple test. Um, and what it is a test that we actually have people come by, and we host the organization that does the test for us in our patient profile, and actually anybody who wants to do it. And so that's really why I'm talking about it, to get it out there. Um, it's called a Carotid Intima-Media Thickness test. And what the test is literally it's an ultrasound, or using sound waves to detect. Actually, just looks at the carotid artery, to look and see what kind of plaque you have. Number one, do you have plaque? What kind of plaque it is, and that actually matters. Most of the heart attacks and strokes occur in people that have the soft, really gooey, fresh plaque. So some of the other standard tests that are done out there really kind of tell historical data. Are you, and not so much are you currently at risk. And so really that's all it is. It's a little ultrasound of your carotid arteries that views what kind of plaque you may have and quantifies it, and then gives you also an inflammation score. What is, again, there's more in the test, and we can get in particulars about the test with you if you're interested in doing it. But again, the big key is that it is a quick, easy way to find out, are you at risk for a heart attack or stroke? And from there, it really gets into, okay, let's pretend you did the test and you came back with, it said something that was at risk for you. What do you do? The good news is that there are physicians who are trained to attack these factors. Remember, I said something early on about 33, elements are involved with heart attacks and strokes. The causative elements. They're trained to kind of go after all of those things. Okay, and so we know who these doctors are. We can kind of help you find them. Again, and I can kind of talk a little bit about them real quick. Before I do that, I'm just going to ask the question, that maybe you might be asking right now. It's like, why is my dentist talking to me about this? Why is a dentist interested in or talking about heart attacks and strokes? What does that have to do with dentistry? And the facts is it has a lot to do with dentistry. I'm going to reach over here real quick and grab a book. There are some doctors that back in 2016 they wrote a paper. Okay? This is the sort of the key paper for everything that we sort of talk about with this. And this was they were the first people to actually link periodontal pathogens, or oral bacteria, to heart attacks and stroke as a cause of strokes and heart attacks. And that was sort of a big deal. Their names are Brad Bale and Amy Doneen. There was another person involved with the research as well. I think it's Dr. David Vigorous. He's just part of the team that helped all that. But they created a book, and they created a methodology for preventing everything we're talking about. And in that, they came out with really why dentistry is involved, and they know for them to be able to do what they do, And literally, if you go through their program, they actually guarantee that you won't have a heart attack or a stroke, while you're under their care, again, as long as you're following their care and following through with what they do. But they knew that dentists were involved. Again, when they write the paper about it, they knew that they needed our help to do it. And so dentistry is helpful for that. And what's involved on the dental side is really there's three elements. The first one is sort of what we alluded to with the periodontal pathogen. So there's known bacteria, again, and they indicated which ones they are, and we actually have testing that we can do to figure out if you have these bacteria or not, and we can help you get rid of them. I'm in a hygiene room today, and it's really instrumental as to the conversation, and that's just it. Your dental hygienists are actually the people on our team that are most helpful to kind of eliminate and take care of all the oral pathogens. And again, my team has been trained in how to handle this and what's the best methodologies and how can we target what we need to do and try to get you on a healthy path. The other elements of dentistry that are involved with that are endodontic lesions. So your abscesses from an infected tooth. The bacteria that are involved with that are just really highly inflammatory, and there's a known issue out there that if you have a certain bacteria that are in these lesions, you have a 25% chance of a heart attack within the next 3 to 4 years. So again, handling these chronic root canals, needed teeth, is definitely something that's valuable for your health. The third element for us is airway. And it's the sleep apnea issue, so breathing and oxygenating the body. And again, sleep apnea has many physiologic factors. Again, all of those increase your risk for heart attack and stroke. So again, addressing that is something that we absolutely attack here at our practice. Anything we can do to help out, whatever path you want to go on from. Again, we have many methodologies to help out, however you'd like to do that. Again, the big question I have for you then again is, if you knew they had a simple test like that could help you figure out if you're at risk for a heart attack and stroke, would you be interested? We host it, point out my little poster up here, we host this event twice a year. Again, it's very simple to do. Holler at us if you're interested, or reach out to any one of our team members and we can kind of help get you on the schedule if we have availability. So again, your dentist is here to help you in many different ways, not just messing with teeth, but again, you just never know how the mouth and the nose are connected to the rest of the body. And we understand that, and we try to help you optimize everything that we can. So thank you so much.